folks, and today we're going to be looking at the top 10 most venomous snakes in the world. Let's get it.
Number 10. The rattlesnake. The only snake from the Americas on this list, the rattlesnake is easily identifiable by the telltale rattle on the end of its tail. They are actually a part of the pit viper family and are capable of striking up at up to 2 to 3/3 of their body length. The eastern diamondback is considered the most venomous species in North America. Surprisingly, juveniles are considered more dangerous than adults due to their inability to control the amount of venom injected. Most species of rattlesnakes have hemotoxic venom, destroying tissue, degenerating organs, and causing coagulopathy. Is disrupted blood clotting. Some degree of permanent scarring is very likely in the event of a venomous bite. Even with prompt and effective treatment, it can still lead to loss of limb or death. Difficulty breathing, paralysis, drooling, and massive hemorrhaging are also common signs of this bite. Thus, a rattlesnake bite is always a potentially fatal injury. Untreated, rattlesnake bites, especially from larger species, are very often fatal. However, antivenom, when applied in time, reduces the death rate to less than 4%. Number 9. The death adder. The appropriately named death adder is found in Australia and New Guinea. This venomous snake actually hunts and kills other snakes, including some on this list, usually via ambush. Death adders look quite similar to vipers in that they have the triangular-shaped heads and short, squat bodies. They typically inject around 40 to 100 mg of venom with a LD of 0.4 mg to 0.5 mg/kg. An untreated death adder bite is one of the most dangerous in the world. The venom is neurotoxic. A bite causes paralysis and causes death within 6 hours due to respiratory failure. Symptoms generally peak within 24 to 48 hours. Antivenom is also successful in treating a bite from a death adder, particularly due to the relatively slow progression of symptoms. But before this development, a death adder bite had a fatality rate of 50%. With the quickest strike rate in the world, death adders bite had a fatality rate of 50%. A death adder could go from the strike position to striking and back again within 0.1/3 of a second. Number 8. The viper. Vipers are found throughout most of the world, but arguably the most venomous is the saw-scaled viper and the chain viper, found primarily in the Middle East and Central Asia, particularly India, China, and Southeast Asia. Vipers are quick-tempered and generally nocturnal, often active after rains. They are also very fast. Most of these species have venom that cause symptoms that begin with pain at the site of the bite, immediately followed by swelling of the affected extremity. Bleeding is a common symptom, especially from the gums. There is a drop in the blood pressure and heart rate falls. Blistering occurs at the site of the bite, developing along the affected limb in severe cases. Necrosis is vomiting and facial swelling, which occurs in about 1/3 of all cases. Severe pain may last for 2 to 4 weeks. Often, local swelling peaks within 48 to 72 hours, involving the affected limb. Discoloration may occur throughout the swollen area, as red blood cells and plasma leak into muscle tissue. Death from septicemia, respiratory, or cardiac failure may occur 1 to 14 days post-bite or even later.
Number 7. The Philippine Cobra.
Most species of cobra would not make this list. However, the Philippine cobra is the exception. Drop for drop, its venom is the most deadly of all cobra species, and they are capable of spitting it up to 3 meters. The venom is neurotoxic, which affects the cardiac and respiratory function, and can cause neurotoxicity, respiratory paralysis, and death in 30 minutes. The bite causes only minimal tissue damage, though the neurotoxins interrupt the transmission of nerve signals by binding the neuromuscular junctions near the muscles. The symptoms might include headache, nausea, vomiting, abdominal pain, diarrhea, dizziness, collapse, and convulsions.
Number 6. The Tiger Snake.
Found in Australia, the venomous tiger snake has a very potent neurotoxic venom. Death from a bite can occur within 30 minutes, but usually takes 6 to 24 hours. Prior to the development of antivenom, the fatality rate from tiger snakes was 60 to 70%. Symptoms can include localized pain in the foot and neck region, tingling, numbness, and sweating, followed by a fairly rapid onset of breathing difficulties and paralysis. The tiger snake will generally flee if encountered, but can become aggressive when cornered. It strikes with unerringly accuracy,